I've been a clinical editor now with HealthPathways Melbourne for about nearly 3 years, into my third year, and we now take up cover two-thirds of Melbourne. We've actually just combined with Eastern Melbourne as well, so our website will cover right over those areas. But in fact, this pathway has been taken up right around Australia. So these are all our collaborators. There are quite a number of us now. So I actually have to engage with all of these hospitals and with all of these specialists. So again, I thank you all for your enthusiasm. It's been very easy with this group, which is great. So what is HealthPathways? It's a web-based portal. So in fact, particularly with Hep C, you'll be able to see when you go on the pathway later on, I do all the hard work for you. I actually bring all those website connections there for you. I try and make this as practical as possible so that prescribing is easy. So the idea is that it's supposed to be used at the point of care, that it is a memory jogger. It's not a medical student instructor. I assume you've all got some base knowledge, and I'm trying to help you with the information you need to make that decision at that time. So at this point, it's not an electronic referral system. In Canterbury, where it comes from, they do have a patient view with the hospitals. So one day it might link in with that, but not just yet. So the benefits, as I said, is that I try and bring together all that information for you in an easy way that you'll be able to follow. The pathways are all systematically organised with assessment, management and referral, and you'll get used to using them as you do use them. So I'm hoping that you'll go to it tonight. Probably the most important information, particularly with this pathway, is the referral information. So we've collected all of that from all of these hospitals. There's the drop down to the phone number, fax. We will link them to your particular pro forma that you choose with the fax number, so that should be able to be printed off from there. The other benefit is that I can update the pathway within a 24-hour period, particularly if there's anything that's wrong. You go to the feedback button at the top, you send your message to me, and I'll actually be able to update that within 24 hours. So that's just an example of one particular pathway, the migraine pathway. And as you know, that's changing, treatment of migraine is changing as well. That's how you access it. And so the Hep C pathway looks a little like this. It would have been lovely to have a live pathway, but unfortunately not been able to. So it has an about section, which will tell you in very concise terms what you've heard tonight. Risk factors, liver cirrhosis, how to, assistance in how to actually diagnose that, and also the tests that we've been through tonight. Some simple guides to what the tests represent, and also the particular MBS item numbers. It's the other thing I've learnt as I've done this pathway, is that there's actually restrictions in testing, and I didn't actually know some of these things, so I've actually put them there where I think they're relevant. So further testing, as we've been through before with our expert speakers. And also the liver fibrosis assessment. This was the trickiest bit for me to actually understand. FibroScan's not MBS subsidised, and I'm uncertain whether that will be soon. Okay. Okay. So at present you can only access it through the tertiary hospitals or through mobile services, so I'll make sure that you'll be able to get that. The other thing you do need to remember though, people still need an ultrasound if you are concerned about liver cancer, so it's not a replacement for diagnosis of liver cancer. But the APRI calculator is there, and the other thing that you will notice on the pathway when you go to it is that there's a nice little quick links box at the top of the pathway. It has the APRI calculator, it has a link to GISA, it has the remote consultation referral link. So things that you need, they should be actually in that quick link box at the top right of the page. This is the description of the specialist consultation as put out by Susan Lee on the 1st of March. So we're still working out how we can do that. We'd like it to be not face-to-face if the patient doesn't have cirrhosis, just for ease and for commencement of treatment, and not to build in any delays. But at the moment, we're still working through some of those hurdles. I've also tried to put in simply the regimens for treatment, and the clinical guidance is actually what Alex was talking about. So there's a link there to the handout, which is actually a very, very nice description of and a concise description of what you need to know in order to prescribe. The hepatitis drug interactions is a link as well, so that's what Alex was talking about too. That's also linked in the quick links, so they're all there as well. The contraindications I actually sort of put together from what I could see. I thought correcting anemia would be useful prior to actually starting the medication, and my understanding was that you actually had to wait 6 months if you did intend to fall pregnant. You needed, both males and females needed to wait. And referrals, so again, just trying to get the process right for how to refer. So, when they say treatment-naive patients, I think they should have prescribing-naive GPs as well. So we're all still learning on how to do this. So of course we've got about 200 plus live of about 800 pathways now. And when we go live, we've tried to link them to all the other links that come off, but also the referral pages, so that's got all the information about the various referral services. And that's me.